Sovereigns from Countryside Veterinary Clinic, and I'm here to talk to you about senior care for your dogs. And we frequently get asked questions that Mackenzie's going to ask for us so I can answer. And I also brought my own little dog today. He was born 12 years ago, and so you can see that he is starting to get senior. His ears are starting to turn gray. He can't see quite as well, so he's going to be our little example today.
And Dr. Sovereigns, what health issues do I need to look out for in my senior dog?
I think the most common health issue that we're going to have in all of our older pets is they cannot see as well as they age. They cannot hear as well as they age. They can't get around quite as much, and some of them develop arthritis, some of them get overweight. Those are in dental care. Certainly that a lot of, especially these smaller dogs, are going to need dental care as they age.
And what are some things I can do to make my aging dog more comfortable?
Well, I think that they need to make some accommodations at home. They can't see as well, so don't change the furniture a lot. Try to make the areas bright, turn the lights on even if you don't think that you would need a light yet. Make sure that there aren't slippery surfaces. The large breed dogs have a hard time on hardwood floors. They need more mats down where they walk. Sometimes we might need to make accommodations such as building a ramp so that they don't have steps to go up and down. And as far as hearing, we need to know that they can't hear as well. Maybe they don't hear you calling them. Maybe they didn't know that there was someone at the door and they get startled by a stranger there. So we need to think ahead and think for them so that they don't get stressed out as much.
And does my senior dog need vaccinations and preventative care?
Yes, you certainly know that an older dog can still get Lyme disease. A tick is going to get on an older dog just as much as a younger dog. A mosquito can bite them the same whether they're old or young. So they still need to be on heartworm preventive. They still need to be on flea and tick preventives. They definitely still need their vaccines. They need to be protected even by law against rabies. And particularly they need to have a physical exam every year so that we can identify problems like whether they can see and hear and what their teeth look like, and if their heart and lungs are normal, if they have a murmur, if they've gained weight. So we can talk about these things together and make a plan so they can live their golden years healthier.
And why does my senior dog sometimes bark at night?
We think that dogs get senile just the way people do. They get sometimes their day and nights mixed up. For instance, an older dog might sleep all day long and then at night get up and prowling around and panting. They might bark. So that's called cognitive dysfunction syndrome, and sometimes we have some things we can do to help with that.
And are there any nutritional or environmental changes I should make as my dog grows older?
Yes, certainly the accommodations we were talking about to the environment, make it brighter, make it less slippery, make less steps. But also nutritionally, we're going to want to probably have foods with less calories in it, less protein, so it'd be safer for the kidneys. Probably joint supplements added to their foods so that the older and the larger breed dogs can help with their arthritis. So there's a lot we can do and adjustments to be made as they get older. So thank you very much for listening. If you have any other questions about your aging dog, please give us a call at 410-461-2400. Thank you very much. Bye-bye.